UNODC is leading a global response to the opioid crisis, as articulated through a 5-pillar UNODC Opioid Strategy. One of those essential pillars looks at international law enforcement operations to disrupt trafficking. And today we're joined by Conor Crean, Scientific Affairs Officer at the UNODC Laboratory and Scientific Service, and we'll be speaking about the challenges posed by COVID-19 pandemic to forensic services and frontline officers. Conor, thank you very much for joining us today.
Thank you, Esma.
Conor, just very quickly, in the context of this dual crisis, the opioid crisis on one hand and COVID-19 pandemic on the other, how has this affected or influenced law enforcement forensic capacity or forensic laboratories' efforts to support interdiction efforts and disrupt trafficking, specifically to synthetic drugs and synthetic opioids?
Yeah, that's a good question, Esma. Due to the nature of the work of law enforcement customs officers, the potential for these officers to encounter potentially synthetic opioids and also COVID-19 in the execution of their duties has increased dramatically recently. This has an effect on the way that they have to do their work, because if you can imagine people who are investigating potentially unknown potent substances, they have to have a lot of safety precautions. So the safety precautions and the personal protective equipment that the officers use, how this equipment is put on, how it's used, how it's disposed of, and yeah, this is very important in this day. And part of the work that we do within the laboratory and scientific services produce a series of guidelines. So the latest guidelines that we've produced are called safe handling guidelines on the guidelines for the safe handling of synthetic opioids and management of risk for law enforcement and customs officers. So these guidelines are even more important at this time, given the dual, as you said, public health challenges. So the guidelines cover topics such as the different types of exposure that can occur when officers are investigating crime scenes and situations where they may encounter synthetic opioids or anything that is an unknown. The individual associated risks with each of these different types of exposure routes and risks, and appropriate personal protective equipment that the officers should wear in order to safely carry out their duties. So we have a guideline, but in order to get this information out to law enforcement officers at this time, we've prepared a series of 7 short instructional videos. So this kind of summarizes the content of the most important parts of the manual and gets it out there to the community so they can have access to it at this time. The first of these videos released this week involved the correct use and removal of an N95 or a P2 particulate mask. So this is an important part of PPE that officers should have access to. In the coming days, we will release a series of videos that include the correct use and removal of nitrile gloves, the correct use and removal of double nitrile gloves for those officers who need to work in potentially contaminated environments for longer periods of time, the procedure for the use of correct eye protection in combination with N95 or P2 particulate masks, another video on the use of an air purifying respirator, and 2 videos, one on a full particulate PPE ensemble and a full chemical resistant PPE ensemble. So in each case, the videos will look at the use of each of these items, their removal and their correct decontamination, because one of the very important aspects is to minimize the risk for cross-contamination. Mm-hmm. So these videos, they form part of the safe handling series of products and materials that we have. These videos and guidelines form part of our safe handling series of products and materials. So this includes training that we do in the laboratory in Vienna and also in the field, and PPE kits. So we're developing PPE kits that contain all the most important essential pieces of personal protective equipment that our law enforcement and customs officers must have in order to safely carry out their duty. And we'll be providing these to all of our clients that we work with.
Thank you so much, Conor, for providing us with this comprehensive overview of how COVID-19 has affected forensic services and law enforcement officers and operations to interdict trafficking in synthetic drugs and synthetic opioids, but also more so for highlighting the crucial importance of proper use of personal protective equipment. And now with the physical distancing measures that are put in place, and in response to the pandemic, to the COVID-19 pandemic, how does UNODC Global Forensic Science and Services Program respond to this complex situation of a dual crisis, the opioid crisis and COVID-19 pandemic, in supporting its network of forensic laboratories and frontline officers around the world to be able to respond to those challenges posed by synthetic drugs and synthetic opioids while observing and maintaining those measures of physical distancing?
Yeah, it's changed the way that we do our work. Currently the laboratory and scientific services UNODC works in a range of different areas to assist the work of forensic service providers around the world. As you said, we have a network of over 280 forensic drug testing, toxicology, customs laboratories in more than 90 countries. So the assistance that we provide for them covers a range of topics, including, as I mentioned a little bit, the delivery of training in the laboratory in Vienna and in the field. We also provide laboratory and field equipment used for the detection and identification of drugs and precursor and drug test kits. In the area of quality assurance support, we have a number of activities, including the provision and implementation of a proficiency test called the International Collaborative Exercises. And we implement this proficiency test twice a year. We also provide reference materials of substances under control and selected new psychoactive substances, and we send these out to forensic drug laboratories around the world free of charge. So I mentioned earlier on the guidelines that we produce. We also have a much greater series of these guidelines, and these cover topics such as the identification of commonly found drugs and also emerging drugs such as synthetic opioids, and how these are analyzed and identified in seized materials and also in biological specimens. We have a number of manuals on quality assurance, so how to implement a quality management system, how to validate analytical methods, and these are very important for the work of laboratories. There are also other subjects such as crime scene investigation, security document examination, and the investigation of clandestine manufacture. So this is quite important also for synthetic opioids and sites where these substances can be manufactured. Related to the guidelines that we're just producing and our other guidelines, how are these substances disposed of? This is very important. So, as we know, most of the work of the forensic community and the services that we provide and deliver to them has changed at this time. So as a result of the crisis, we have had to adapt the way that we do our work and think of innovative new ways to be able to provide our services to the officers who need them so that they can safely carry out their duties. One area as an example of what we have had to change recently is in the area of training. So we work in the provision of handheld devices for the field identification of drugs, precursors, and chemicals. We've provided these in collaboration with our own Global SMART program, with some other regional programs in the Container Control program and CrimJust. So we provide these to member states. So what we normally do is we provide a device for the forensic laboratory and a device for the frontline officer. We bring both these groups of people to the laboratory in Vienna and carry out a 2 to 3 day training, provide them all the information they need to know how to correctly use this equipment. We can't do that at the moment. So we've had to reschedule some of the trainings that we're doing and think of different ways of doing it. So last week, excuse me, in collaboration with the Regional Office for Eastern Africa and through the Container Control Program, we developed and delivered a virtual training. So we had, I think, 9 officers in one location and another number of officers in different locations, all connected to the laboratory in Vienna, where we had our lab technicians all in the taking account of social distancing, delivering training online. So we know that going forward, this is something we're going to do more. So we're providing more training on the use of these devices to other recipients, and we'll also be developing other webinars and other online training based on many of the services I mentioned earlier, so that we can get what we can from all of the products that we have and provide this to our clients at this time.
Thank you, Connor, for identifying the portfolio of UNODC Lab and Scientific Services capacity building and technical assistance programs. And I can only imagine how challenging it is at this time to maintain the same level of capacity building and technical assistance programs in this challenging time of physical distancing and COVID-19. But it is quite impressive to see how adaptable these programs can be, and how the Lab and Scientific Service is catering to member states' needs even during this time. And speaking more specifically about that, how can member states who need support in strengthening their drug control related forensic science and services and their responses to the opioid crisis during this challenging time of the global pandemic and the physical distancing challenges we spoke of, how can they benefit from UNODC Global Forensic Sciences and Services Program and all the portfolio of services that you just spoke about?
Yeah, there's quite a lot that we have just briefly given an introduction to, but people can find much more detailed information about gaining access to the services and tools that we have, or registering for a proficiency test or for reference materials at our website. So unodc.org/laboratory. And also many of or all of the forensic aspects of the work that we do are incorporated within the United Nations Toolkit on Synthetic Drugs. So this can also be accessed on the webpage of UNODC Opioid Strategy. It's also possible to access all of the latest updates that we provide on our activities on social media, such as Twitter. So at UNODC_lab, you can find us there. And also you can use more traditional methods and write an email to us. So you can contact us at unodc-lab@un.org.
Perfect. Thank you so much, Connor, for taking the time to speak with us today, and to the UNODC Lab and Scientific Services in helping to protect those that protect us by keeping them safe and confident to execute their essential duties and services to keep our communities safe from synthetic drugs and synthetic opioids during this challenging time of the dual crisis. And if I got it correctly, again, it was www.unodc.org/LAB for lab, and unodc.org/opioid strategy, one word. Thank you very much, Connor, once again, and hopefully we'll see you on the other side of this pandemic very soon.
Thank you, Asma.